Hello, today I'd like to discuss a common question that people have about the liposuction procedure. Today I'm just going to describe exactly what happens the day of your procedure so you can have a better idea of what to expect. Since we do liposuction here every day, or we do a very high volume of liposuction, this is our routine day in, day out. It's normal for us. And we do the same thing on everybody to keep things consistent and make sure that we do the right thing and get good, consistent results. So when you come into our office, the first thing you'll do is you want to make sure that we have all your paperwork filled out. We do send this paperwork to you prior to the procedure, before you get here, so it could be filled out before you get to our office. If it's not, then you'll have to spend the time to read through our paperwork and fill it out before we bring you back. Once you get back to our procedure room, you'll deal with our support staff, our medical assistants, and they're going to do some simple things like take your blood pressure. We'll also take various measurements of the areas that we're treating. In addition, we'll be taking many pictures from various angles to document the way you look before the procedure. We'll also take your weight and take various pinch tests. So we'll actually pinch to see how much fat you have in that area so we can document where you start. These will also be tests that we will do afterwards to show how much of a change you've had. Once we've got all the measurements done and the pictures done, the liposculpture specialist and myself will come in and I'll get you marked up. We'll also do a formal consultation, discuss exactly what it is that you're looking for and what your goals are, and I'll make my recommendations to see if we can accomplish those goals. And at that time I would mark up the areas that we're going to treat. So this is like my roadmap and shows me exactly where we're going to be treating, where we're going to go to, where we're going to start, and where we're going to finish. Once you've agreed to all this stuff and agreed to the areas that we're treating, then we can go ahead and get you medicated, and at this time we give you some antibiotics. Also, if you're anxious and nervous, we could use anxiety medication like Xanax. And also if your blood pressure is elevated at this point, which it tends to be elevated on most people just because they're nervous and anxious before their procedure starts. So we use blood pressure medication to counteract that. The first part of the procedure is the numbing part. That's the part that tends to be a little bit uncomfortable. You kind of feel like a pinching sensation. To make this part a little bit easier, we would put ice on the area. The ice dulls the nerves and it makes it feel a little bit more comfortable during the numbing process. That numbing process, essentially what I'm doing is I make tiny little puncture holes. They're 2 millimeter, very small. These are my access points to pass my instruments under the skin. So I can pass my first instrument under the skin and it's going to spray this fluid, and the fluid consists of saline, which is just salt water, lidocaine, which is numbing medication, epinephrine, which is medication that constricts the blood vessels, so it makes for very little bleeding during the procedure. This solution is injected into the fat layer, into the areas that we're going to treat. It fills up that space in there and it gets you numb and it constricts the blood vessels. So this is the magic, the secret sauce that allows us to do this procedure under local anesthesia while you're awake. And it's much safer and much more cost efficient. The next part, once we get all numbed up, is the aspiration, or the removal of the fat. This is the fun stuff. This is what you came for. We're removing fat in large volumes. So once you're numbed up, I'm going to pass this instrument under your skin. This instrument is called a cannula. It's like a hollow tube or a straw-like instrument. It's got a couple holes at the tip there. And when I pass this under the fat layer, it's going to break up the fat and suck it out into a canister. And so I'm going to spend all my time trying to make sure that everything is evenly removed and things are smooth and even so we can get the best results. Now, once all the fat's removed, you're going to have a space in that area. So that space isn't going to remain. Your body's natural reaction is going to want to fill that space with fluid, so it's going to want to swell up. So what we do is we're going to put a compression garment on. A compression garment closes down that space and reduce the amount of space that your body can swell into. We ask that you wear this compression garment for about 2 weeks following the procedure. This will reduce any potential bleeding afterwards to get you have less bruising and a quicker recovery. It also reduces the amount of swelling in the area. Again, it'll reduce your recovery to much quicker if you can get rid of the swelling quicker. So again, we ask you to wear the garment for 2 weeks at a minimum, although there are many people that choose to wear this longer, particularly they'll wear it at night when they sleep. There's no scientific data behind this. This is a recommendation. Some people will need to wear this longer, some people will not. We kind of leave it up to the patients, but we do request a minimum of 2 weeks with the compression garment. After the procedure is done, we're going to get the compression garment onto you into the treated area, after which we will bring you into our recovery room. In the recovery room, you'll get to sit on a nice, comfortable leather reclining couch, lie down, relax. We have a video for you to watch, post-op video. It gives you some instructions, some idea of what to expect post-op. In addition, we're going to take your blood pressure and make sure that you're doing fine. After about 20-30 minutes, as long as you're doing fine, everything's going well, you're feeling good, then you're free to go at that point. We'll make sure that we get you, call your driver or call your cab, get you on your way at your own convenience. Hope you guys enjoyed, and if you have any other questions, please give us a call.